Hello, my name is Natalie David. I recently graduated from Strongsville High School and I will be attending the University of Chicago in the fall. Over the summer, I worked in the main campus emergency department through the science internship program, and the title of my research is Characteristics of an Observation Unit at an Academic Tertiary Care Hospital. Observation medicine units, or observation units, were implemented in emergency departments to provide streamlined diagnostic evaluation and treatment for patients, and patients that spend time in the observation unit are usually too ill to go home for outpatient care, or are not quite sick enough for hospital care or need further diagnostic testing. Patients are roomed in an observation unit for up to 24 hours, which is about the standard time frame, and they are undergoing constant evaluation by physicians, nurses, respiratory therapists, and the like. Observation units have many advantages when they're coordinated with an emergency department. They are associated with increased patient satisfaction, a fast, efficient workup because labs and imaging are readily available because they can use the emergency department's resources. Observation units are associated with shorter inpatient hospital stays because some of the testing and diagnostic stuff that is done in the observation unit prevents a longer stay in the ER or the inpatient areas. It decreases cost because it can prevent a hospital admission by doing some of the tests on an outpatient basis. And it also provides a more comfortable environment for patients, family members, and friends because it offers more privacy than a standard emergency department room. Nationally, the reasons for admission into observation units varies, but about half of patients are admitted for diagnostic evaluation, and then among the other half, it's split rather evenly between therapy for a patient's condition, psychosocial illness, and outpatient procedures. For my research project, we examined a list of patients that were admitted to the Cleveland Clinic's observation unit, which is also known as the CDU, or Clinical Decision Unit, and we looked at a database of patients from January through March 2011, and we looked at factors that may influence length of stay and disposition, or whether or not a patient is admitted or discharged. And for these patients, we gathered information on their demographics, so their ethnicity, age, and gender. We looked at diagnostic testing that was done, including labs, imaging studies, and consultations from other medical specialties. We looked at treatment variables, including IV fluids, aerosol medications, and IV medications or other things, and also the patient's medical history, including their comorbidity. What we found was that the length of stay progressively increased by age group. So the pediatric patients had a much shorter length of stay on average than the geriatric patients, and this was seen as an upward trend. Patients that were admitted to the hospital also had a higher average length of stay, as evidenced by the green bar on the graph compared to the blue bar, which were patients that were discharged home. And a possible reason that patients that were admitted had a higher or longer average length of stay was that whatever floor they are admitted to, those physicians need to come down and evaluate the patient beforehand, and that can contribute additional time to their length of stay. The average length of stay by age group for pediatric patients was 10 hours and 19 minutes. For non-geriatric adult patients, this average length of stay was 11 hours and 17 minutes. And the average geriatric adult length of stay was a bit over 12 hours. So you can see the upward trend by age group. The chief complaint for observation unit patients also played a role in length of stay. So about 32% of patients that are admitted to the observation unit present with chest pain. About 20% present with abdominal pain. 13% complain of shortness of breath. 12% have nausea, vomiting, and/or diarrhea, and about 8% of patients complain of headache in the observation unit. We noted that most of the common chief complaints require several laboratory tests, radiology studies, and consultations to rule out serious life-threatening conditions. For example, patients that come to the emergency department with chest pain, they spend a large amount of time in the observation unit to rule out a heart attack, and that's done through many repeated EKGs and sets of cardiac enzyme labs. And this graph shows that the average length of stay by chief complaint. So a rather small percent of patients that are admitted to the observation unit with chest pain stay less than 10 hours, compared to many more of these patients with headaches or nausea, vomiting, and diarrhea do leave within 10 hours of being admitted to the observation unit. And also, we looked at the most common diagnoses in the observation unit to see if we could explain the difference in average length of stay between adults and pediatric patients. And for adults, the most common final diagnosis was unspecified chest pain, abdominal pain, congestive heart failure, asthma, syncope, transient ischemic attack or mini stroke, and chronic obstructive pulmonary disease. And for pediatric patients, they usually had less severe complaints or diagnoses, including asthma, dehydration, abdominal pain, gastroenteritis, pneumonia, fever, and head injuries. And these more complex or serious diagnoses in adults require more complex workups, including more laboratory tests, radiology studies, and consultations, which contribute to their average longer length of stay and more hospital admissions. And these, many of the most common pediatric diagnoses do not require such extensive workups. And in general, fewer radiology studies are done for pediatric patients to limit their radiation exposure. Examining disposition, about 83% of observation unit patients are discharged home, compared to 17% of observation unit patients that are admitted into specific floors of the hospital. The highest admission rate for a particular diagnosis is congestive heart failure, and about 50% of those patients are admitted. And for patients presenting with gastroenteritis, only about 4% of those patients are admitted from the observation unit. So in conclusion, we determined from our study of patients from January to March 2011, only age, chief complaint, final diagnosis, use of radiology test, especially the MRI machine, and use of consultations from specialties are associated with a longer length of stay and disposition. And particular specialties also seem to contribute more to the length of stay. For example, general surgery and colorectal surgery take a longer time to come to the observation unit for consultations because they usually wait until their day is done in the OR around 5 o'clock, no matter when the patient has arrived in the observation unit. And we found that gender, ethnicity, and medication use were not associated with a longer length of stay or a greater hospital admission rate. And so based on this data, we can recommend that pediatric patients overall have a shorter length of stay and lower admission rate compared to adult patients. So we can use that information to help emergency departments to plan that pediatric patients use fewer resources than adults. And in general, better management of chronic conditions such as congestive heart failure and chronic obstructive pulmonary disease can prevent emergency room and observation unit visits, or if the patient does need to come into the hospital, it can reduce their length of stay. And this is a reference we use for the presentation. At this time, I would like to thank my mentor, Dr. Sharon Mace, for her help and guidance with my project, my peer mentor, Andriana Stevens, collaborating interns Sophia Chinchilla, Claire Lowe, Emily Richards, and Stephen Steffes, the main campus emergency department for welcoming so many students for the summer, and finally, the Office of Civic Education Initiatives for providing me with this outstanding opportunity. Thank you.